Good afternoon. Today our subject is what disease can cause arterial disease. Number one, we have to pay attention to hypertension, high blood pressure. We have to look at this hypertension coming from. Number one, the kidney. We have to look at the function of a kidney. The next is pulmonary, the arterial of a lung, which is a gas exchange happened to it. And also liver, sometimes by simple as a disease of a fatty liver. The next component is a low on essential fatty acid in the blood. Essential fatty acid is a component of a two-factor EPA and DHA. Our system have something called prostaglandin. Prostaglandin component which is activated by essential fatty acid of a EPA, which is anti-inflammatory in prostaglandin 1 and 3. And prostaglandin 2, it is a arachidonic acid activator which is cause inflammation. Next component we have to pay attention to CRP, C-reactive protein. When CRP elevated, that will cause arterial disease. CRP is an endogenous protein at the acute stage of inflammation, injury, bacterial and viral in our system. CRP produced by liver. Next component we have to pay attention for arterial disease, excess of a triglyceride. In our bloodstream, cholesterol and triglycerides circulate as a lipoprotein complex, which is all component of the cholesterol as VLDL, HDL, IDL, LDL, contain apolipoprotein B. When those number it is increased above normal will cause arterial disease. The next component we have to pay attention, it is the excess of a fibrinogen. Fibrinogen is an endogenous globulin and is a soluble protein, cause blood viscosity and also process blood clotting. The next component is a low vitamin K. Vitamin K is a fat soluble vitamin, prevent calcification of artery, slow down process of a blood clotting. Throughout the day, when we are under fluorescent light, studies show fluorescent light can destroy vitamin K. Next component, which is we deal or we consume day in and out, and like our consumption is way more than it should be, it's the glucose. Excess glucose in our system, the first damage be on our artery. Glucose is the only carbohydrate that circulate in our bloodstream. The next component it is the excess of a homocysteine. Homocysteine is a toxic endogenous sulfide contain amino acid, like some of the amino acid like a lysine. Homocysteine increase in our system when we are deficient on vitamin B12. On our artery, homocysteine will cause atherosclerosis and also blood clotting. Next component we have to pay attention, it is our insulin. Excess of a secretion of insulin from pancreas eventually become insulin resistant. Blood sugar cannot be attached to insulin to move to the cell, stay in the circulation and cause the damage to the artery. Next component is our hormone. As we get older, specifically for male, is a low testosterone combination of a total and free. We have to pay attention to the free testosterone. Testosterone secreted by testes and also by adrenal cortex of our adrenal gland. Synthesize and convert in our system to estradiol because it's a component of estrogen, and we need that estrogen in a male for the small amount. Free testosterone bind to albumin and move through the circulation. Whenever we are low testosterone, so many other damage can come from it. The next component we have to pay attention is a nitrous oxide. Nitrous oxide is a component which is relaxing the artery and preventing clotting. And specifically in our immune system, white blood cell monocyte, which is traveling throughout our artery, they attach themselves to the wall and cause the atherosclerosis. For that reason, nitrous oxide, it is important to relax the artery to prevent. And nitrous oxide is a component which is a vasodilation. I hope that be informative for you guys, and hopefully have a great day and see you next time.